You know your blood type. Maybe you learned it before surgery, or from a curious parent, or you looked it up once online. ABO AB. You stored it somewhere in the back of your mind, right next to your shoe size. A neutral fact, a label, something that only matters if you end up in an emergency room. But here's what most people never find out. Your blood type is not just a label, it is a set of standing biological instructions that your body has been following since before you took your very first breath. It affects your heart, your brain, your immune system, how you handle stress, which viruses hit you harder, and most people have no idea. Today, I'm going to change that. Stay with me, because what I'm about to share could genuinely protect your life. Problem. Explanation. Let's start simple. Picture your immune system as an extremely thorough security guard. Its entire job is to check every single cell in your body and ask one question: do you belong here? Now, how does it know? Every cell in your body carries a tiny molecular ID badge on its surface. Scientists call these antigens. Your immune system memorizes your antigens from birth and treats anything foreign as a threat. Your blood type is simply about which ID badge your red blood cells are carrying. Type A? Your cells carry the A badge. Type B? The B badge. Type AB? Both badges. Type O? No badge at all. The surface is completely bare. And this is where it gets serious, because that tiny difference in molecular ID shapes everything, from how your immune system fights infection, to how your blood flows through your arteries, to how your brain ages over decades. This isn't a minor biological detail. This is one of the most powerful and overlooked forces in your personal health. Symptoms and warning signs by blood. Let's go through each blood type, and I want you to really listen for yours. Type O. The original human blueprint. If you're type O, here's something you should know. You have a natural resistance to malaria, a survival advantage your ancient ancestors depended on. Your blood cells have a slippery surface that certain parasites simply can't grip. Sounds great, right? But here's the scary part. That same slippery surface means your blood is slower to form emergency clots. Type O individuals carry lower levels of a critical clotting protein called von Willebrand factor. In everyday life, you'll never notice. But in a serious accident, major surgery, or significant internal bleed, that lower clotting ability puts you at measurably higher risk of dangerous blood loss. And there's more. That same surface that protected your ancestors from parasites? It's like a perfect landing dock for norovirus, the virus that causes vicious stomach bugs, projectile vomiting, and dehydration. While other blood types shake it off mildly, type O carriers tend to get hit the hardest, every single time. Type A, the survivor built for cities. If you're type A, your blood type evolved during one of the most dangerous transitions in human history, when people stopped being nomads and started living in crowded cities next to animals sharing water sources. Your blood type gave your ancestors a powerful immune weapon against the bacterial infections that were wiping out early city populations. But here's the trade-off you need to know about. Type A blood is thicker. It clots more easily. And over decades, that extra viscosity quietly builds pressure on your cardiovascular system. A landmark study following tens of thousands of people found that type A individuals carry a significantly higher independent risk of coronary artery disease, heart attacks, strokes, arterial blockages, and it doesn't stop there. Type A individuals also release higher baseline levels of cortisol, your body's main stress hormone. And after a stressful event passes, your cortisol stays elevated longer than other blood types. Your immune system literally keeps your stress response running hot. That chronic, low-level inflammation is silently wearing on your heart every single day. Type B, the adaptive nomad. Type B is the rarest of the common types, roughly 1 in 10 people. It evolved in nomadic populations crossing Central Asia and the Himalayas, where the environment changed constantly, and survival required rapid immune adaptability. Type B carriers are notably resistant to norovirus, While type O people are floored, type B individuals often barely notice it. But here's the dangerous side of that flexibility. An immune system built to respond rapidly and flexibly has a higher error rate. And for type B individuals, the data consistently shows elevated rates of autoimmune conditions where the immune system stops attacking outsiders and starts attacking you. Your own joints, your thyroid, your nervous system. There's also a statistical association between type B blood and a higher risk of pancreatic cancer, one of the most difficult cancers to detect early. The research has been replicated across multiple independent studies. This doesn't mean it will happen, but it means it's worth watching. Type AB, the rare one, with a hidden cost. Less than 5% of people have AB blood. You're the universal recipient. In a medical emergency, you can receive blood from any type. That's a real biological advantage. But most people with AB blood don't know this. AB blood produces high levels of a clotting protein called factor VIII. This makes your blood substantially thicker than other types. In the large vessels of your body, that's manageable. But in the microscopic capillaries threading through your brain, that thickness is a problem. Over decades, it can create tiny, silent vascular events, microscopic disruptions in brain blood flow that don't produce obvious symptoms, but accumulate into measurable cognitive damage. A longitudinal study found that AB blood type carriers are dramatically more likely to develop early memory and language difficulties, the first signs of dementia, compared to every other blood type. The same immune permissiveness that makes you a universal recipient may be costing your brain. Why it happens now? You might be wondering, why would our blood types cause such different outcomes? How did this happen? The answer is evolution. And it's a story of survival under pressure. Every blood type emerged because of a specific threat that existed at a specific time in human history. Type O dominated when the biggest killer was malaria and scattered survival. Type A appeared when humans crowded into cities and bacterial infection became the great equalizer. Type B evolved in nomadic populations facing constantly shifting environments. Evolution doesn't build perfect designs. It builds responses to whatever problem exists right now. And here's what nobody talks about. Those ancient immune advantages are still running in your body today. But the threats they were built for, most of them are gone. You're not surviving a malaria epidemic. You're not drinking contaminated water in a medieval city. Your blood type is still fighting old wars in a world that has completely changed around it. The protection it gives you in one area creates a vulnerability somewhere else. That's not a flaw, that's biology. But it is something you need to understand. Solution and prevention. Here's the most important thing I want you to hear. None of this is destiny. A higher risk is not a certainty. It is information. And information, used correctly, is power. Let me give you something real, something you can actually use. If you are type A, your cardiovascular system needs active management. That means a primarily plant-forward diet, vegetables, fruits, whole grains, legumes. That means keeping your stress response in check. Because your cortisol runs high by default, and unchecked stress accelerates arterial damage. Meditation, consistent sleep, and moderate aerobic exercise. And please, get regular cardiovascular checkups. Don't skip them. If you are type O, be aware of your clotting profile. If you're going into surgery, make sure your care team knows your blood type and understands the bleeding risk. For norovirus protection, robust hand hygiene is your single best defense. And if you're ever prescribed blood thinners, discuss your baseline with your doctor carefully. If you are type B, your immune system runs flexibly, but sometimes triggers false alarms. Chronic inflammation is your quiet enemy. An anti-inflammatory diet, rich in leafy greens, omega-3s, turmeric, and ginger, directly counteracts this. And, given the Pancreatic Cancer Association, make sure you're prioritizing regular abdominal imaging if you're over 50 or have any family history. If you are type AB, Your brain health is worth protecting proactively. That means cardiovascular fitness, because what's good for your heart circulation is directly good for your brain. It means omega-3 fatty acids consistently from food or supplementation. It means keeping your blood pressure tightly controlled. And cognitively, stay challenged, read, learn new skills. Social connection protects aging brains. And this is true for every blood type. Know your numbers, blood pressure, cholesterol, blood sugar. The earlier you catch a deviation from normal, the easier it is to correct. Your blood type tells you where to look. Your habits determine what you find. I want to take a moment and be direct with you. The people who don't take this seriously are the ones who walk into their doctor's office at 58 with a heart attack, or find out about pancreatic cancer at stage 3, or watch their memory quietly erode across their 60s without understanding why. They had the same information you have right now. They just didn't act on it. But if you catch these risk patterns early, the type A person who manages their stress and diet can dramatically reduce their cardiovascular risk. The type B person who controls inflammation can shift the odds against autoimmune flares and cancer. The AB person who takes brain health seriously in their 40s and 50s can protect their mind well into their 80s. The type O person who understands their bleeding profile can make smarter decisions in emergencies before they become crises. Early awareness is not fear. Early awareness is a head start. I don't want you to walk away from this worried. I want you to walk away informed. Your blood type is not a verdict. It is context. It is a window into the evolutionary history your body carries. The specific biological trade-offs that were shaped by generations of survival under pressure you will never face. The immune system you were born with was built for a world very different from the one you live in. Understanding its calibration, where it overreacts, where it underresponds, where it was optimized for threats that no longer exist, is one of the most useful things you can know about yourself. You cannot change your blood type, but you can change how you live inside it. That's what medicine is for. That's what this channel is for. You now know something that most people will go their entire lives without knowing. Use it. Before you go, I want to ask you something. Think about someone in your life, a parent, a sibling, a close friend, someone who doesn't know their blood type, or who knows it but has never thought about what it actually means. Share this video with them. Right now, before you forget. Because the information in this video isn't just interesting. For some people, it could genuinely change how they approach their health. It could change how they talk to their doctor. It could catch something early that would have been missed. That's worth 30 seconds of your time. If this video helped you understand something new about your own body, and I hope it did, hit the like button. It tells me this kind of content is valuable to you, and it helps me keep making it. And if you want to understand your body better, if you want medical information that is clear, honest, and actually useful, subscribe. I make one promise. I will never talk over your head. I will always give you something real. I'll see you in the next one. Take care of yourself. Because no one else has your exact biology,